Hi, thanks, Laura. Hi, everyone. Thank you for joining us today. My name is Benjamin Sense, and I'm a Human Services Analyst with the Department of Human Services, Office of Income Maintenance, Bureau of Policy. My work focuses on the Compass website, and I'm one of the program administrators for Compass Community Partners. So I help manage community partners' registration requests and accounts, and I address any questions and concerns, try to resolve any issues that they might run into. The main purpose of this webinar is to answer the questions that you've provided, but we've also prepared a brief high-level overview of the Compass Community Partner Portal just to give you an idea where to start when using Compass and maybe answer some of the more common questions you might have. So to begin, dhs.pa.gov/compass will bring you to the Compass homepage. And this homepage is used by individuals to apply for benefits and access their My Compass accounts, but community partners also use it to access the community partner dashboard. So we'll go to the next slide here. So this is the Compass homepage. So today, for our purposes, there are two things you should take note of here. One is at the top right, you'll see the login register, and towards the middle there, you'll see the helpful links. We'll do helpful links first. So under helpful links, there's three important items that I'd like to point out that could be helpful to community partners and teach you more about using Compass. So these include a web-based tutorial and two quick reference guides. One about Compass and the community partner dashboard, and one about how to register as a community partner. These are helpful guides to using Compass. I should also mention that there's no prerequisite training required before registering as a community partner. Community partners can be community-based agencies, organizations, medical providers, and other groups that want to help Pennsylvanians submit applications and/or renewals for health and human services. We have a lot of different kinds of community partners, from food banks to law firms, hospitals. If you engage with the community, you can probably register to be a community partner. So if you hover over the login register there in the top right corner, you get a menu of login options that come down. So make sure you're clicking under the community partners section on the top left, and that'll bring you to the community partners landing page. So this page is where you will log in or register as a community partner. I'd like to point out on this page we have some of the benefits to becoming a community partner, which include submitting and tracking all applications and renewals in one location, e-signing applications and renewals on behalf of applicants and recipients, viewing statuses of submitted applications, and viewing messages from headquarters, and much more. So I've included the URL at the bottom in case you want to bookmark it, since this is what you'll be using to log in as a community partner. So if your organization has not yet registered as a community partner, you can do so by clicking on the Start Online Self-Registration link at the bottom right. You'll need your organization's tax ID number, the FEIN, and an email address. Once the organization has been approved, each new user will also need to go through registration again to receive their username. The username is also known as a B-user ID, a business partner ID, or a Keystone ID. You might hear it called those different names. There's a link to the registration quick reference guide below, and that has more information about the process. That's the same thing that was linked under helpful links that I showed you earlier. Many of you might already have a business partner ID from another state service, and you may be able to use that same username for Compass. So if you receive an error message or you have any questions while you're registering, you can contact the Compass Community Partner Resource account, and I've linked that at the end of the presentation, and we can help you set up the account correctly if you run into any trouble. All right, so once you're registered and able to log in, you'll be able to access the Community Partner Dashboard. And from here, you can access all the features available to you as a Compass Community Partner. You'll see that your saved and submitted applications and renewals are displayed there at the bottom. And so over the next couple slides, I'll show you a few of the features that might be helpful to you with a focus on renewals specifically. These include renew benefits, quick reports, search applications, and check renewal date. Submitting a renewal on Compass is very similar to submitting an application. However, the renewal will have the individual's household information pre-populated from the case, so it'll take less time than doing a brand new application. So to start a new renewal, click on the Renew Benefits link right there towards the middle of the page. Okay, so this is where you'll start a renewal for the client, and you'll check the box at the top there indicating that you received the recipient's consent, and then you'll need to enter their county and case record number, renewal date, and the social security number for the head of household. After that, then you'll go through the renewal workflow and where you can update any information related to the case. And so I wanted to pause here to address one of the questions we received. So for individuals that don't have a social security number, we're currently working on an enhancement that will allow users to enter their recipient ID instead of the social security number, and we hope to have that in place soon. Next, we'll look at quick reports. Quick reports just gives you a glance of the applications or renewals that your organization has submitted. It's broken down by county and benefit type, and it shows applications or renewals from the past 30 days. Under the information tab, we have some links to program information, as well as downloadable and printable common forms that the CAO will use. And so the next one is the administration tab. The administration tab is available only to delegated administrator users. And here you can see a list of registered users at your organization. And you can also go in and approve new users by clicking on the work list. More information about administrative functions can be found in the online self-registration guide. And if you have any questions about that, that's also something you could send to the mailbox. So next we'll look at search applications. And so the search applications tab allows you to look up applications, including those that are greater than 30 days old that won't display on your dashboard. And the results can be filtered by date range and looked up by various identifying criteria. Another important tab is the check renewal date tab. This allows you to look up a recipient's renewal date using their county record number and social security number or ID number. And then that's on the right there, that's what the results will look like. So back to the community partner dashboard. So your submitted and saved applications list includes both applications and renewals. E-form numbers for renewals begin with an R as opposed to a W. So that's how you can distinguish them in that list. There's several options for each application and renewal, and by hovering over the application, you can view the summary PDF of the application, check the status, view only the signature page, or attach scanned documents. If you click attach, you can select supporting documents to upload and submit to DHS. So each document will be associated with the e-form number that's indicated at the top. And so make sure you're attaching the correct documents for the correct individual. And then you just click I am finished and it'll submit them. If you want to check the status of an application, click on the status and verification. And there you see there's 4 statuses there. If an application status is not available, you can check back again later. It might be that it was just submitted. And if it remains unavailable for an extended period of time, you can contact the DHS helpline for more information. So I hope that gives you a general idea of the main features of the Compass Community Partner Dashboard that you'll be using to complete renewals during the unwinding. Here I've included that email address for the Compass Community Partner Resource account, and you can email us there with any questions related to using Compass or registering as a community partner. Please don't submit any questions about specific cases or renewals to that mailbox, though. We won't be able to answer them. Those can be directed to DHS Helpline or the CAO that the renewal is being submitted to. So now we'll take a look at some of the questions that you submitted prior to the webinar, and we'll see if we can answer some of the items that we haven't covered yet. And I do see that there's some more questions in the chat, so I'm going to look over those as soon as I get a chance here. Okay, so I'll start with the questions that we had pre-submitted here. First, we had, so is the MA renewal application the same as the full MA application? And the answer to that is it's very similar. However, Compass renewals are pre-populated with the existing case information. So while much of the same information is required, the process is a lot faster than completing a new application. We also had, can we renew applications without the client's code? So the head of household on the case's security number, case record number, and renewal date are required in order to renew. And community partners must also indicate that the individual has given their consent to submit the renewal on their behalf. What will the organization, excuse me, what will the organization need to do for all the renewals that have been submitted without documentation? So the County Assistance Office will request any additional documentation that is needed with a PA 253 pending verification list. And community partners can assist by uploading documents to the pending renewals from their dashboard. Next question. Sometimes it is difficult to renew someone's benefits without their case record number. Is there another way to assist them with the renewal? So renewals can't be initiated without the case record number, but this number is on most documents that are mailed to the client from DHS. It can also be found in their My Compass account if they have one. They can also contact the customer service center or the DHS helpline to obtain their case record number. Next one, if our patient/MA beneficiary wants help setting up a Compass account, is there training that gives our sisters step-by-step instruction? There is a Compass quick reference guide and a Compass web-based tutorial under helpful links as well that is geared toward the individuals and families, and it has information on setting up the My Compass account. And there's also a Compass flyer with this information, and we can send that out after the webinar. Another one, why can we not see the documents that have already been submitted for clients? So currently Compass doesn't support a list of uploaded documents, but this is an enhancement that we're hoping to complete in the future. What if a participant does not have an income but receives money from a family member who does not live with them? So this can be entered during the Compass renewal or application as other income. And so there's a drop-down menu on the other income page, and you would select other, and then you could enter descriptions such as support from outside of the household. Another question, can we have renewal dates accessible on Compass even if individual cases were not recorded in Compass in a given year? The answer is yes, renewal dates can be looked up for all cases. And you would do that using that check renewal date tab. Are there any restrictions for MCOs to assist community members via the Compass Partner site for MA renewals? We think no, but if you're able to elaborate on this question, please do send us a follow-up to our contact email. But from our perspective, there's no restrictions. See, do we get our own login for each individual we assist? So, no. Community partners have one username and password that is used to access their dashboard. Another password is created for each application and renewal, and that can be used by the client to check the status of that application or renewal. So that's something that you would share with them while you're doing the application, and then they can use that to check on it later. How often do benefits renew, and what documents are needed to renew? So renewal periods and required documentation vary by program and individual circumstance. So that's something that they would reach out with that PA 253 form to request that. And we also have how many registrants are allowed per MCO. Each Compass Community Partner organization can have up to 4 delegated administrator users and an unlimited number of business partner users. So as many helpers as you need to register, we can register them. Have they updated the income guidelines? So the federal poverty income guidelines are updated annually, and they were recently published on January 17th. And Compass will be updated to reflect these new amounts soon. Another question, do I need my client to sign a release? Signed release is not required for submitting applications and renewals on behalf of individuals and families. And the last one we had, so parents without a social security number should be able to renew on Compass, and it will be beneficial if SARS could be completed on Compass. So we're working to introduce an enhancement that will allow Compass renewals to be initiated with the recipient ID number, as I mentioned earlier. And this would be similar to how the recipient ID number can be used to create a My Compass account instead of a social security number. We're also working on enhancements that will allow SARS to be completed on Compass. And that's something that we hope to put in the future as well. So I think there were some additional questions, and so I will turn it over to Nikki for those questions, and I'll review the chat here and see if there's anything else I can help you with. Thank you.
Good afternoon, everyone. My name is Nikki Blythe, and I'm with the Department of Human Services, Office of Income Maintenance, Bureau of Policy. Ben and I work together. So I'm going to go over a few more questions that we received that weren't specifically Compass related, but have to do with either part of the unwinding or just kind of general questions. So one that we also received in the chat that I'm going to go over now is we received the question, how will it work for those with emergency Medicaid and renewals? So our plan is for each emergency medical assistance recipient, they'll receive a renewal packet in the mail, and they will also receive a separate mailing during the month of their renewal, which will contain the emergency medical condition information eligibility form, also known as the PA 1917. And there will be a letter that goes with this form informing the individual that they must verify their emergency medical condition to continue to receive coverage for the emergency medical condition. So that's for emergency medical assistance. We also received a question, what is the anticipated processing delay for MA renewals after March 31st? And our response to that is that we do not expect any delays at this time. The next question we received that also has to do with unwinding is, if a Medicaid recipient has submitted their renewals throughout the pandemic, will they still be evaluated for continuing eligibility? And our response to this is yes, but if they have continued to renew their benefits and have continued to be eligible, and are not only eligible because of the continuous coverage requirement, they will be evaluated for continuing eligibility when it's their regular renewal time or when they report a change in circumstances. The next question is, I know there is a 12-month wind down for managed care organizations after the end of the public health emergency. But what will that look like? How will it tie to the member's renewal? And here we suggest that you check out the DHS PHE Unwinding page for important information. There's a managed care organization Q&A document that's located under the stakeholder kit section on the Unwinding page, which can be found at dhs.pa.gov/phe. We received a question, what's to come after the end of the public health emergency with renewals and benefits? So the Consolidated Appropriations Act of 2023 set April 1st, 2023 as the end of continuous coverage for MA and CHIP. After April 1st, 2023, the Department of Human Services will return to normal eligibility processes. This means that all MA and CHIP recipients must complete an annual renewal to see if they are still eligible for coverage. MA and CHIP recipients should watch for the renewal and complete it as soon as they can to avoid a loss of coverage. We also received a question on what is the length of time individuals will be notified prior to losing coverage. And so similarly to how it works now, if an individual has their medical assistance coverage ended, they will be provided with 15 days advance notice. If they're enrolled in managed care, their coverage will often go until the end of the month in which the end of their coverage date lands. One question that we received, this is kind of similar to another one, but if customers have renewal dates before April 2023, will the unwinding impact them in 2024? And our response to this is if a customer has kept up with renewing their benefits and they continue to be eligible and are not only eligible because of the continuous coverage requirement, they will not be impacted by the unwinding period. And another question we had is, will agents be compensated for assisting consumers in obtaining Medicaid coverage? And the answer to that is no. In general, Compass Community Partners, assisters, and other helpers are not compensated for helping consumers obtain or maintain Medicaid coverage. Some organizations may have separate grants they have received to assist individuals, but these grants are not part of being a Compass Community Partner. So that was, oh wait, we had one more question about Medigap coverage. And the question to that was, when the public health emergency ends, will those who have aged into Medicare and are no longer eligible for Medicaid receive guaranteed issue status for Medigap? And so with that, our response is so Medigap is still applies, but there is a new special enrollment period for individuals who have missed their Medicare enrollment period and are terminated from medical assistance. So once they receive their notice of termination, they have a 6-month period to enroll in this special enrollment period. So that's something that's helpful to people. But in terms of the Medigap question, we suggest that you contact PA Medi at 1-800-783-7067. And that's it for the questions that we received ahead of time. And now we can kind of start looking at the chat.
Hi, everyone. Yeah, this is Ben again. I'm looking at some of the ones from the chat, and so I might be able to help out with them. I do see somebody ask, please explain the process for changing an administrator. So what you would do is just register the new delegated administrator, and then you could send an email to that Compass resource account with the credentials for the old administrator, and then I can revoke access for those. But really, you just need to have the new person register first, so that they're already registered as administrator before we revoke any access for the old ones. Another one related to delegated administrator access says, can a community partner user be both an entity administrator and an assister? So yes, you can. So the delegated administrators have the same access as the regular users, uh, except they can just approve new regular users. So they will have the same username and password. Yes, and actually, the first user that you register at your organization needs to be a delegated administrator, because there has to be at least one if they need to approve any additional users. And I do see you ask how long it takes to approve these. I approve most of these, so I usually get them done within 3 days of receiving it. It shouldn't be a full 7 to 10 days, but it could be. But usually within the first 3 days of receiving the request, I'll be able to approve them. Another good question, I think, is says if a company has different divisions, can an account be set up for each division, or is just one for all the individuals? So if you have multiple locations, you can register multiple locations under the same Compass Community Partner organization. So the key with that is using the same tax ID that you used the first time you registered the organization, even if maybe your other wings have different tax IDs. But we can set up to I believe up to 15 different locations, uh, and then you can select from a drop down and switch between those locations to see applications only submitted under that location, and then you can have as many users under each one as necessary. Each location must have at least one delegated administrator.
Hey Ben, it's Laura. Just checking. I know we've had quite a few questions coming in through the chat. Just wondering if it would be easier for one of us on the participant side to read these out to you and have you answer them as they're coming in.
Yeah, that could be. I'm kind of going through and cherry picking ones that have to do with my area expertise. So there might be some that I'm not able to answer, but maybe someone else on the call can. I did see there was like some chip related questions and things like that. So that might be a good way to do it, but I might not be the one to answer each of them.
Okay, no problem. So what I would ask is just if the folks who are participating from the DHS side, if you have
presented as we're going through some questions, and could come off mute to answer those questions. Coming off mute is a manual thing. We certainly would appreciate it. So one of the questions that came in, this is a great one, and I'm sure one that folks will have on their minds. If someone receives a renewal in January, will they be sent another renewal in April due to the unwinding?
This is Nikki. I can take this one. So I think it depends if they don't complete their renewal, then they're now they're being maintained due to the public health emergency. So then they would have to receive a renewal during the unwinding period. But if they completed their renewal, they were still eligible based on that renewal, then they wouldn't have another renewal until their regular renewal time.
Thank you so much, Nikki. And Ben had referenced a CHIP question. We will need to take that question back to CHIP. So the question was, what happens to the CHIP participants that owe money? We will need to take that back to our partners at CHIP, and we'll get an answer to that question for you all. So thank you for that. So we've gotten several questions regarding whether or not there is a phone number specifically for community partners. Is there a phone number other than the 800 number? Folks have mentioned, various folks have mentioned needing translation services, and then that connection can take a little longer when someone is in front of them and needs help right away. Could one of our co-hosts please answer that question?
Hi, this is Nikki. So there isn't a phone number for community partners, but at the end of our presentation, which is showing right there, there is a community partner mailbox that you can reach out to us. Now, again, this is typically for registration or Compass questions or concerns. It's not typically about specific recipient information or case information or anything like that. So in that situation, you would have to call the DHS helpline or the customer service center.
Thank you so much, Nikki. And this is another question for you. A couple of folks in the chat have mentioned some lag times or getting booted off of Compass, and I believe that is something that they would need to go to the resource account, the email address that you had mentioned. Is that correct? If they're having technical issues?
Yes, that's correct. They should contact us through that mailbox there, that resource account.
Great, thank you so much. And I know that a few folks have asked questions regarding MCOs and resources as they pertain to MCOs. And please let us know. We are not able to answer those questions right now, but we are going to take those back and get the expert answers that you all need and want to make sure that we can answer those questions properly and thoroughly. So we will follow up after this call to get you all that information. And just flipping through the questions here, please bear with me for 1 second. We had a question on how will emergency Medicaid cases be handled for renewal?
This is Nikki. I addressed that earlier, but I can kind of go over it again if that would be helpful. So emergency medical assistance recipients will receive a renewal packet in the mail for their renewal month. And then at during their renewal month, they will also receive a separate mailing which will contain an emergency medical condition information eligibility form. And we'll also have a letter that goes along with it that's just informing them that they must verify their emergency medical condition to continue receiving coverage for that condition. Otherwise, they would be reviewed for other MA and closed if they're no longer eligible.
Great. Thank you so much, Nikki. It's much appreciated. So I would like to just kind of open it up to our co-hosts. Are there any other questions that you would like to answer, or anything else that has come up for you in the course of this call that you'd like to speak to before we wrap up today?
So this is Nikki. I just want to say that we have a lot of good materials that we can provide. I know this was said in the chat, but we have a lot of good materials that we can send out after this webinar. We have a more comprehensive community partner dashboard slide deck that goes over the features in a little bit more detail. And we have an online registration slide deck that's kind of accompanies that online self-registration guide that Ben mentioned earlier. And we also have a renewal workflow that we can share that I think will be really helpful. Filled out.
Yeah, I did
Thanks
want
so
to
much,
mention, it
Nikki.
looks like some of you are working on registering now because we're getting some requests rolling in. So I'm going to look at those and if we get through those this week sometime.
Yes, wonderful. Thank you all so much for your commitment to help. As we have, and thank you, Nikki and Ben, we will have the slides, a recording of this call, and additional resources being sent out after this. It may take just about a day or so to get everything together, but we will be sending that to you very, very soon. So thank you so much for participating today. And please, as you can see, it's on your screen there. If you have questions, please direct them to our resource account, the pa.gov resource account. So thank you so much. And we will talk to you soon.